So collateral ligaments, we'll talk about those for a little bit of time. They are incredibly difficult to interpret, and that's because they are fraught with artifacts. Every horse has got something to say. It's very easy to imagine that if horses have got balance issues or conformational issues, that the collateral ligaments will not be a pair, and that's just something which we have to try and work around. They are variable in their size, in their signal intensity, and the tissues around them and what they're doing. They're quite breed specific, so big horses have got big ugly collateral ligaments and little fine horses have got nice neat ones. It's tricky as far as your slice positioning is concerned. If the horse is leaning and you're trying to slice through them in a transverse plane, you're going to be oblique through one and you'll be straight through the other. So they're very prone to over-interpretation, and actually it's probably under-interpretation because they're so difficult to interpret that you tend to think, oh, please make there be something else to see so I don't have to go down that route. But it takes a lot of time to make the right decisions about these ligaments, and it's important because they've got to, you know, if you're going to give a horse a diagnosis of collateral ligament disease, then it's quite a serious thing, so you want to make sure that you're getting that right. And yes, they are still prone to over-interpretation, so if you're struggling for diagnosis, many people just can put that as a finding, and I think we're probably pinning that disease on a few too many horses. But when you see the obvious ones, they're quite dramatic, so it's important to remember where they're positioned, so they're sort of more dorsal than most imagine, and you can look, this is a horse with a ruptured proximal collateral ligament, and you can see the bump hopefully over the coronary band here. Now this bump is usually periligamentous fibrosis rather than swelling of the ligaments, so if you ultrasound that area and see the ligaments of normal size, then sometimes it's actually because there's periligamentous fibrosis around it, and that can confuse you a little bit. Most horses with old chronic desmopathy, they won't be painful to squeeze. This is a horse that did have a proximal relatively acute injury, so he doesn't like it too much when I press on the tissues around there. Again, you're probably not pressing on a painful ligament, you're pressing on distended coronary vessels and inflammation in the periligamentous tissue that they're resenting. They have quite a, when they're bad, they have quite a clear presentation. They'll often, oops. So this horse has got a collateral ligament injury. You can see that whenever he loads that leg okay, he's not too bad. Then he trips, and that makes him quite a bit sorer. They're often laying with the leg on the outside on a soft surface. And this was his injury, so again, I've used this image already, but you can see this area of hyperintensity in the transverse and the dorsal plane here. You can see all that periligamentous tissue that's formed around there. They tend to be a bit like suspensory branches in that they kick out lots of tissue. They're not all that obvious, unfortunately. This is a horse on the left with large feet, and they have these sort of just difficult to define from the surrounding tissue. This is a gradient echo sequence, and they're difficult to interpret on gradient echo sequences. They often have what, if it was another breed, you'd write it off for collateral ligament disease, and then they are fine when you shoe them, and there doesn't seem to be a problem. So you have to be careful with these bigger horses. And these are more acute injuries where we've got high signal in the ligament, periligamentous hyperemia. They're quite nice cases as well, and really tricky to see on ultrasound. How do I manage them? Well, these types of severe, these x-rays are nice to take. If you have got a rupture, if you're worried about it, just do these stress views where you stress the outside or the inside of the joint. This type of horse needs to be put to sleep. That's going nowhere. It's really the only option there. Focal injuries with a short history of lameness are very rare, but if you do get them, then they respond quite well to controlled exercise, some joint medication. I tend to put a little bit of the medication around the injury as well, so if you're using IRAP, for example, I'll do an ultrasound-guided intralesional injection, which can be quite nice. I put almost all of them in roller shoes, so the half-round section shoes. I really like those shoes for this type of disease. And the chronic diffuse desmitis horses, they're often competition horses. Controlled exercise, keep medicating them with whatever they respond to, and you can keep them on the road very well. So we mentioned the cartilage of the foot already, so I won't go on too much. We've got a little bit more to get through, but just to say that again, if you are the cartilage of the foot are back in fashion, they certainly can be evaluated very well with MRI, and we're now appreciating a whole raft of injuries associated with them, and this is to show the ligamentous support to those collateral cartilages. So here's the cartilage here. These ligaments as well, intimately associated with the collateral ligaments and involved in that type of pathology. So if you see these types of things popping up on reports, then that's what we mean. So, and again, you can see them here. This is a horse with a degenerate collateral cartilage here, and these ligaments are wrapping around and gluing onto the collateral ligaments.